Good afternoon, everyone. Thank you for joining our session on Safe at Home, a housing approach to support women's right to remain in their home when fleeing violence. The work we'll be speaking about today is funded by the generous support of the Catherine Donnelly Foundation and carried out by the Women Abuse Council of Toronto, or Women Act. For those of you who may not be familiar with Women Act, we're a policy and planning body that works collaboratively to end violence against women through coordination, research and policy, and education. We convene and mobilize communities across Toronto to drive system change for women, and we've been doing this work for 30 years now. Many of our research and policy activities focus on women's economic security, including housing security, and that's the focus of our Safe at Home project that we're excited to speak about today. So in terms of the presentation, we have 3 learning objectives that we'll be using to structure the session. So by the end of the presentation, we hope that you will all be able to describe the components and outcomes of the Safe at Home housing model, understand the housing needs and preferences of women with experiences of intimate partner violence, and summarize some of the opportunities and barriers to implementing Safe at Home interventions. These 3 objectives map onto the 3 distinct components of our work that we'll be speaking about today. So the first one is a literature review, which synthesizes the current evidence on interventions that support survivors to remain in their own home when leaving a violent relationship. The second is our mixed methods research with survivors of intimate partner violence, where we conducted surveys, interviews, and focus groups to capture survivors' housing experiences and preferences. And then third is stakeholder engagement, where we convened a group of multi-sector stakeholders to start a dialogue on Safe at Home and share their perspectives on advancing this housing model. To start us off, we of course need to understand what is Safe at Home. And within this work, we've conceptualized Safe at Home by the definition you see up here: a housing approach for women living with an abusive partner to either remain in the shared home with their partner removed or to move directly to independent housing when leaving the relationship. And I'll get into some of the specifics of how this program model works in a moment. It's important to note here that there is no universal definition of Safe at Home housing approaches. And in many cases, they only refer to models where the survivor remains in the shared home. But we've taken a wider definition in our project to also involve direct moves to independent housing. And this is based both on some of the existing program models, but also on the preferences that we heard from communities when we were designing this project. So why have we been looking into this housing model? There's a few reasons. So first, we know that the dominant response to intimate partner violence, where women and children are expected to leave their home and usually go to temporary housing options, this response creates significant challenges for women. And I don't think it's a surprise to anyone here today, but fleeing violence is a leading cause of women's housing instability and homelessness, and it creates major life disruptions for women in areas like employment, social networks, or service access. We also know that requiring women to leave home in order to reach safety is a violation of women's right to housing. Specifically, this violates the right to security of tenure, where women are entitled to stable housing regardless of their relationship or family status. Beyond these issue-based rationales for Safe at Home, we also have jurisdictional evidence for their success. Safe at Home models are already a core housing option for women experiencing violence in places like Australia and the United Kingdom. And they've been around for a while, since the early 2000s, but there's been limited work to date on Safe at Home here in Canada. So we have a dominant response that isn't always working well for women, and then we have a program already widely implemented elsewhere that we can lean on for direction. And so with these 2 things in mind, we set out to collect the evidence that could help advance Safe at Home models in Canada. With this work, we're aiming to understand the policies, programs, and practices that could support women to remain in independent housing when leaving a violent relationship. As I mentioned, the first stage of this work was a literature review on the program design, outcomes, and best practices of Safe at Home housing models. And I'm going to briefly share some of the evidence included in this review so that we all have a better understanding of Safe at Home before we discuss our primary research findings. So Safe at Home programs tend to focus on 2 main goals: to remove or exclude the perpetrator from the home and to reduce the risk of violence for women and their children. To address these goals, they typically involve some combination of 5 main components. The first is legal orders. These can include exclusion orders that regulate the occupancy of the home, protection orders like no contact orders or bail conditions, or even housing policies like evictions or lease transfers that are enacted in response to violence. The second component is multi-agency risk assessment. So this is typically carried out on an ongoing basis to determine if remaining in the shared home or independent accommodation is a safe and appropriate option for the survivor. The assessment may evaluate things like the property features, the proximity to emergency responders, or perpetrator characteristics like the level of violence or where they live. Another important component of Safe at Home is home security measures and safety devices. These are measures provided to the survivor to physically secure the home against entry or to alert for an emergency response. These can include alarm systems, reinforced windows, security cameras, external lighting, so on. Safe at Home programs also provide wraparound supports for survivors, and this usually involves referrals to agencies that can offer support in a range of areas, whether that's legal advocacy, counseling, or health services. To help women navigate these supports along with their housing, Safe at Home programs often provide case management services as well. The final component found in some Safe at Home programs is perpetrator programs. This component is not necessarily as common as the four others, but some programs do offer emergency or transitional housing, as well as counseling services for the perpetrator, with the ultimate aim of reducing risk for the survivor. And then, because this is a very intersectoral program model, Safe at Home involves a number of core partners working together. These include community agencies, who often play the central coordinating role, the criminal justice system, both law enforcement and courts, and then as well, housing providers and landlords and security providers. These multi-agency partnerships allow for program referrals, safety planning, crisis response, and wraparound supports, all the pieces that make up a typical Safe at Home program. Now, since Safe at Home has already been widely implemented in other jurisdictions, there's quite a bit of evaluation on it already, and there are lots of benefits that have been reported, both at the individual level and the social or economic level. Survivors who have participated in Safe at Home programs have reported improved safety, confidence, and well-being, and fewer disruptions to their everyday lives, compared to the more traditional experience of relocating to temporary housing options. Safe at Home has also been found to contribute to reduced repeat incidents of IPV and reduced homelessness caused by IPV, which would of course have effects on service and housing needs. And then there are also benefits for the partners involved in Safe at Home. Participating agencies have reported that collaboratively delivering Safe at Home programs has strengthened the ways that they communicate, the ways that they integrate services, and even led to cost savings for many sectors compared to operating under a more crisis response model. To ensure that Safe at Home programs can actually realize those benefits, there are some best practices that were reported in the literature, and those will be important to keep in mind when designing Safe at Home programs. First, Safe at Home should always be positioned as one of many housing options for women leaving violence. This housing approach does not work for everyone, and it does not replace the need for shelters or other temporary housing options. So instead, it should be thought of as one more tool that we have to expand the range of housing options available to meet the diverse needs of survivors. In terms of the partners involved in the delivery of Safe at Home, it's important to have formal partnership agreements that clearly guide the roles and responsibilities, and to have all partners trained on trauma-informed practice. And then looking at the supports components, Safe at Home programs work best when the supports are rapidly implemented, flexible over time to meet survivors' changing needs, and can promote economic security, whether that's directly through financial supports or more indirectly through employment or financial literacy training. Bringing this evidence together from our literature review sets the frame of what Safe at Home looks like in practice and why it's an intervention worth exploring. And we use this evidence to guide our primary research. Great, so in this part of the presentation, we're going to walk through the findings from our mixed methods research with survivors of intimate partner violence, where we were able to learn about their housing experiences and preferences. And I'm pleased to be joined for this portion of the presentation by our Women Active Peer researcher, Lauren Parcher, and she's going to be presenting some of the findings as well. So our primary research used three methods of data collection: an online survey, semi-structured one-on-one interviews, and then design thinking focus groups. And we recruited participants first for the online survey, which was shared through email by community agencies across Ontario. And upon completion of the survey, participants were able to opt in to participate in an interview or in a focus group. And so the data we'll be presenting here is from across all three of those data collection methods. And to participate in the research, participants had to be a woman or gender diverse person who lived with an abusive partner and separated from that relationship in the past 5 years, where one or both partners left the shared residence at the time of separation. So very quickly, I can just share some of the demographics of our participants. So in total, we were able to engage 74 women in the research through the survey. And then 12 of those women additionally participated in an interview and 9 in a focus group. And we had a pretty good mix of demographics overall, but just wanting to note here that participants were often low income, had children, or were living in urban settings. And as well, they had a range of experiences with intimate partner violence. In terms of our findings, so we can first look at participants' housing experiences. And so in this section, there was really no universal housing trajectory for women when they were separating from an abusive relationship. Women really faced a number of unique circumstances and unique barriers, and that led to a range of housing decisions being made. But there was one kind of overarching or general pathway that emerged more often than others. So among the participants that we spoke to, most lived with their partner in the private rental market, and they were a leaseholder on that unit. Yet in contrast to this, 80% of participants reported that when they separated from their partner, they relocated. And in many cases, among almost 60% of participants, the survivor was the one to leave the home while the partner remained there. And in line with the existing evidence, most women who we spoke to were accessing temporary housing options, with the two most common being staying with family or friends or going to an emergency shelter. Thinking a bit about kind of why this was the most common pathway, survivors frequently reported that there were very limited housing options available for women experiencing violence. And in many cases, this lack of housing options directly prevented them from leaving their relationship earlier. And as you can see here, even the most available housing options, which were shelters or staying with family or friends, those housing options were only available to less than half of participants. And we also see in this graph that those safe at home housing options, so staying in the shared home or moving to a new home, those last three there, were not usually available to women. And especially in the case of moving to a new home in the private housing market, no participants actually accessed this as their first housing option after separation. This chart can also tell us that even when certain housing options were available, they weren't always able to be considered or accessed by participants. So we heard about barriers like wait times, the distance commuting to work, disability accommodations that couldn't be met, the stigma associated with certain housing options, and all of these acted as barriers that further limited the already limited housing options that would meet survivors' needs. But probably the biggest factor that we heard about in limiting access to housing was affordability. So survivors often mentioned that their housing search was most restricted by finances above anything else. So even the cost of moving expenses alone was prohibitive for some women to consider some of these housing options. And we heard about a range of economic challenges that survivors were experiencing, whether it was insufficient social assistance rates, financial abuse that affected credit scores or eligibility for income supports, or the inability to work due to trauma or due to the abuse carrying over into the workplace. And participants often discussed kind of this broader context of a housing crisis where rents were becoming less and less affordable for them. And they really saw that as further exacerbating these financial issues. Then there were a bit of a different set of challenges that arose for survivors once they separated from their partner, and that was the impacts of their new housing situation. And we want to keep in mind here when looking at these impacts that about 80% of participants relocated as their first housing option. So many of these impacts here are capturing the effects of relocation specifically. So around half survivors or more, in some cases almost 70%, were reporting impacts like disruptions to their social relationships or employment, a loss of control over their housing options, and for many women, still feeling at risk of harm from their partner in that first housing option accessed after separation. And sometimes when we try to kind of synthesize these impacts with quantitative data, with graphs and all of that, as helpful as they can be in telling the overall story, it can sometimes make things a bit lost that these numbers do reflect women's stories. And so we wanted to take a moment here to just share the experiences of two of our participants in particular who were quite impacted by relocation. And so in one case, we spoke with a survivor who shared the impact of relocation on her employment. So she was someone working in a temporary role that was set to be made permanent around the time that she had to relocate to a shelter. And so she shared the situation with her supervisor. She took a few days off of work to move, but when she returned, the permanent position was already filled by somebody else. In another case, we already heard from a survivor. We heard from a survivor who was living with a physical disability, and they had moved in with family members who lived in a different area of the city. And for the first few weeks of living there, they were unable to leave the home at all because there was a delay with moving the paratransportation service to the new address. And so they couldn't access any of their usual services. They couldn't take their kids to and from school as they usually did. So just adding on another layer of stress to this already stressful transition time. And I'm going to turn things over to Lauren now, who can share more about the experience of the small group of survivors we were able to speak to who did actually stay in their own home at the time of separation.
So survivors who stayed in their formerly shared homes discussed various positive impacts and benefits for themselves. So survivors noted that there was less disruption to their life than relocation would have been, including detrimental economic impacts of moving, and it allowed children to maintain their school and social relationships, and less concern around finding other housing or the risk of becoming homeless. So feelings of empowerment and control were also discussed by survivors as a positive impact of staying in the home. And the sense of stability and familiarity offered by their home was grounding when dealing with trauma and undergoing a challenging separation. Survivors also noted a feeling of sense of ownership over their place that was further realized when they were able to keep it as their own home. One survivor shared that staying in a familiar place meant she had a better knowledge for safety planning. One survivor shared, and this is a quote, "One of the positives in terms of being able to stay in the apartment is when your life is in shambles after a violent relationship that sort of impacted your life from a holistic point of view. Having to look for an apartment, having to move, it's one less thing to worry about." Survivors also discuss strategies that improve their safe at home experience. So security measures. So survivors reported changing their locks, installing security cameras, using personal alarm devices, and putting locks on their windows. These measures help survivors feel safer should their partner return to the home. Another strategy used by survivors was changing the look of their home. So rearranging furniture or buying new decor. This helps survivors limit the reminders of the abuse that took place in that space. So what was missing with the safe at home experience? So survivors did note that they had continued safety concerns after their partner left the home. So not only did they fear that their partner would return to harm them, but they felt that the overall safety of their building or their neighborhood also put them at risk. Some of these concerns were intensified by the limited justice system response that survivors reported when staying in their home. A couple survivors felt that they could not contact police about safety issues for fear that the situation could be turned around on them. It was also noted that the legal options for survivors to stay in their home, where restraining orders were reported to cover insufficient distances around the neighborhood or insufficient periods of time to provide a sense of ongoing safety. Survivors also discussed concerns around economic security, so such as dealing with tenancy agreements, where survivors experience conflict around rent payments. So some of those examples survivors discussed were private landlords threatening to raise the rent in response to safety complaints, threats from partner to expose lease violations that could jeopardize social housing eligibility, and disputes over returning rent deposits after their partner had moved out. Survivors also noted that other housing options, especially affordable independent housing, was missing from their decision about where to live after separation. So staying in the shared home wasn't necessarily their first choice. Remaining there often reflected the barriers to finding other housing, such as long wait times for social housing programs, or being unable to lose their current affordable rent and pay market rent elsewhere. And the survivors also discussed insufficient or unaffordable security measures. So while some survivors improved their feelings of safety through home security measures, others felt that this was unaffordable or insufficient to prevent harm. So one survivor did share a stressful experience where they had to pay $300 to change their locks. Another discussed having to install and monitor their own security cameras, as utilizing a security camera was well beyond their financial means. And there's just a quote at the bottom from one of the survivors. And in one way, it was more comfortable because I had all of my things there, but in another way, very dangerous to stay there. So this graph just shows what participants' housing preferences. So this would be if survivors were looking back into their experience rather than what they actually experienced. So survivors reported that the safest and most appealing option when they're separating from their partner would have been to move into a new home, either in the private market or the housing program, or going to an emergency shelter or staying with family. The appeal of moving to a new home, which was selected by 52% of survey participants, was echoed in interview discussions where almost all survivors shared that their ideal housing situation at the time of separation would have been to move directly to independent housing. So these preferences aligned with survivors' perceived benefits and concerns about the safe at-home housing model, where the version of the model that involves staying in the formerly shared home was thought to carry more risk than the version that supports moving to a new home. And it's important to note that not always that the most appealing option was the safest option for survivors. So both versions of the safe at home housing model were thought to offer similar benefits. So survivors did report a sense of control over their housing circumstances and over their own space. So whether they were staying in their shared home or moving directly to independent housing, survivors noted that this option was associated with feelings of justice, security, stability, and comfort. Safe at home was also seen as providing tangible improvements and fewer disruptions in many domains of their everyday life, including health, mental health, employment, safety, social relationships, and children's behaviors, compared to the other housing options that they had accessed or considered. So one survivor said, "At least I didn't have to worry about basic things like having a roof over my head, and I can start addressing more of the job-related issues in the student loans and everything else. It's like once the housing is in place, it's a little bit easier to feel less overwhelmed and to kind of try and address the other stuff." Survivors also noted that learning about the supports offered by the safe at home housing model made this option more attractive to survivors. It strengthened survivors' preference to move into a new home and lifted the option to stay in their shared home above going to an emergency shelter or staying with family. Survivors also did note that there was some concerns for staying in the home. So those concerns included their partner knowing their location and the trauma attached to that space, complications with the tenant agreement and entitlement of the unit, and harm or retaliation for keeping the shared home and already living in an unsafe area. Survivors also discussed concerns around living independently. So living alone could cause fear, anxiety, and stress, contributing to negative mental health. It also included financial barriers to housing affordability, such as losing employment, issues with credit score, or relying on unlivable social assistance rates. So one survivor said, "I wouldn't have been able to stay in my house with my children because he was the one paying for it. He would pay the landlord, then not pay the landlord, so I would be behind in my rent. If he didn't pay his child support, then I'd be short on rent or food." And for some survivors, living on their own also meant worrying about making independent decisions, their children's safety, and whether their partner had access to other housings and support. So even with supports in place, survivors still had concern about the safe at home housing model, which included affordability of housing costs and security features, having access to only short-term supports, and their partner returning to the home and causing further harm.
So with some of these concerns in mind, we wanted to dive a bit deeper into how Safe at Home could be structured as a program to address some of these challenges. And we really wanted to understand, what did survivors see as making up the ideal Safe at Home program, and what were the components they would need in place to address some of these concerns effectively? And so we started by asking about the traditional program components that we had identified in the literature review, and you can see those up here. On the whole, survivors reported that most of the components of that typical safe at home housing model would contribute to their safety in this housing option. So there was quite widespread interest, particularly around legal orders, case management, and wraparound support services, and then more moderate interest in some of the home security measures and housing policy tools. And then interestingly, survivors felt that the perpetrator components of the program, which typically would provide supports and housing for their partner or ex-partner, didn't have a large role to play in their safety as part of this housing model. We also asked participants to prioritize or rank these components. That way we could get a sense of which were most important to them. And the top ranked supports overall were two types of legal orders. So one that was more an exclusion order and one more of a protection or no contact order. And these coming out as some of the top options really emphasize the role of the justice system as part of the program. And then as well, survivors also prioritize multi-agency supports in areas like counseling, legal advocacy, peer support, and so on. But then we also wanted to open the discussion a bit wider beyond what Safe at Home already traditionally includes. And so we had participants share some more open-ended responses about the components that would make up the ideal Safe at Home program. And many of the ideas that we heard did parallel the existing model components, but we did also hear about some great new ideas that survivors were looking for. And these ones that you see on the slide here are really only a sample of those new ideas. There were lots of creative suggestions for the program that we received. But just to touch on a few of these, we heard a lot about financial supports or emergency funds actually being embedded directly within the program. And this really linked back to some of those concerns around affordability standing out as a very clear barrier around housing access or concern about independent living. And some Safe at Home programs have incorporated funds into them in the past, so it's not something entirely that's a new idea, but it was much more of a priority here than it is in kind of the typical program model. We also heard that it would be important for women to be offered multiple housing options at once that they could choose from, and to have supports be permanent, but then decline in intensity over time as skills and needs were changing. Some more specific supports that survivors shared were having their partner wear a legally mandated GPS tracking device that would be monitored by law enforcement, or receiving new furniture and decor to change the environment of the once shared home, something we also heard about as a strategy that was used by women who did stay in their shared home. Then beyond the program support specifically, participants spoke a lot about community safety, that regardless of what the program model offered within it, they would need to be residing in a building or in a neighborhood that felt safe to be living on their own in the first place. So taking all of these findings together, we asked survivors as kind of a final question. If all the supports that you wanted were in place, hypothetically, all these kind of supports that we've talked about so far, where would you prefer to live when separating from an abusive partner? And we can see here that learning about the supports that could be offered by the Safe at Home housing model made it a more attractive option. So if we think back to the beginning of our presentation, these results here are really in direct contrast to that earlier data about where survivors are actually going when separating from an abusive relationship. And so we can see that those potential safe at home options, those first three there, reflect the preference of 76% of participants in total, and that the preference for those options is far surpassing the housing options that are much more common in reality, going to a shelter or staying with family or friends. And again, you can see here that less than 10% of participants prefer each of those options when supports for independent living are part of the equation. And so what we're really seeing here is that there's quite a big disconnect between what's happening and what's actually desired by survivors. And I think this graph here really provides the key message of our mixed methods research, that if we can design a thoughtful safe at home program with strong supports in place, both at a program level and a policy level, this is something that survivors do want as a housing option. And so it should be something that is available to them alongside other housing options that are part of the current system. For the final section of our presentation, we're going to share some insights from multi-sector stakeholders on the barriers and opportunities that they see for implementing Safe at Home in Canada. Last month, WOMANAC brought together a group of 13 senior leaders from across sectors for a planning session on Safe at Home. We had a focus on Toronto in particular, but the findings do apply more broadly. In this session, we had representation from community agencies, municipal and provincial government, the criminal justice system, and then housing and gender-based violence research and advocacy organizations. With this group, we were able to discuss how Safe at Home addressed the program and policy goals of different sectors, the considerations and concerns for implementation, and existing levers and strategies that could play a role in future work on Safe at Home. In terms of key considerations, stakeholders shared ideas in three main areas: program design, the housing and service system, and policy. They really emphasized here that there were three different levels to be mindful of that might pose barriers to Safe at Home. Looking first at program design, a key consideration we heard about was affordability, that there were limited supports available to help survivors address the expenses associated with independent living. We also heard about some knowledge gaps in the area of program design. Stakeholders felt that they would need more information around how this model works for racialized communities and for different levels of IPV risk. We also heard about barriers to working within the existing housing and service system. There were concerns about the lack of housing stock, the lack of trauma-informed approaches, and the lack of service integration. These issues really pointed to a need for more training and more trust building between sectors before they'd be able to deliver this type of collaborative program model. And then finally, stakeholders brought forward some higher level policy considerations that could prevent a successful Safe at Home program. We heard about limited tenancy policies that could support removing the perpetrator from the shared home. We heard the important point that Safe at Home assumes early contact with the justice system when that's not the case for many survivors, depending on their situation. And we also heard broader frustrations that funding and policy priorities are often not gender responsive. So trying to secure the buy-in and the resources for this type of program may not come easily within the existing funding streams for housing and homelessness. But then on the flip side of these concerns, we also heard about a lot of great opportunities to start getting Safe at Home on the agenda. Things that were going on right now where Safe at Home could be introduced and really start the dialogue and start the problem solving around some of those considerations. Some of the opportunities that stakeholders brought forward were gender-based violence and housing strategies that were under development by government. So getting Safe at Home in there as an opportunity to meet certain strategy goals. We also heard about funding opportunities for rapid housing that had been created in response to COVID-19. So really they're leveraging that urgency to create some action more quickly. We also heard about existing partnership tables, whether that was among anti-violence against women agencies or housing providers, and that these could be a forum where collaborative discussions could take place. And then we also heard the suggestion to leverage some existing housing programs and priorities, whether that's rent subsidies, eviction prevention programs, or the wider interest in hidden homelessness. And that was really about using all of these different levers together to start raising awareness of Safe at Home and to start mapping out where different program components could sit within our existing system. Then we ended our session with a bit of a broader question for stakeholders to really move our thinking beyond just program design to some of the norms and attitudes that exist around housing solutions for intimate partner violence, because that can be just as big, if not bigger, of a barrier as some of those policy or service system considerations. So part of advancing Safe at Home in Canada will really be understanding how we can shift some of those expectations to be open to new housing solutions. And you can see some of those norms up here that we heard from stakeholders. So that shelters are the only option, that violence has to be physical to access this kind of intervention, the silos we have between sectors, the way we allocate funding for women's housing, and then bringing us kind of full circle to the rationale for Safe at Home, this norm that women experiencing violence should have to leave their home to be safe. So all this great information from stakeholders really makes it clear that there's a lot of work ahead to design and to implement Safe at Home programs in Canada, and that it's unfortunately not as simple as kind of putting together a pilot program and testing it out. There are still changes needed to policies, to our service systems, and even to our social norms around intimate partner violence. With that in mind, we're very happy to share that Women Act has recently been successful in receiving funding from WH Canada to continue our Safe at Home work over the next 2.5 years. And so the next stage of this project will be looking to address those policy and system prerequisites so that we can continue moving toward implementation of Safe at Home programs. And we're very much in the planning stages of this grant right now, but the work will consist of 3 main components. So first, service and system planning. So here we'll continue bringing together multi-sector stakeholders to develop partnerships and to identify opportunities for collective next steps. The second part will be around policy strategy. So we'll be conducting policy analysis to understand and act on the relevant policy and funding barriers to advancing Safe at Home. And then third will be some capacity building. So we'll be working with the sectors who would be involved in Safe at Home programs to provide training on housing options and to work towards shifting those norms and attitudes that usually guide our response to intimate partner violence. We're excited to be able to continue this work and to continue learning from others who are carrying out related research and related interventions across the country. We're really looking forward to these next steps, knowing that Safe at Home can help to improve the housing outcomes of women experiencing violence. Thank you so much for joining our session today. If you'd like to stay up to date on Safe at Home and Women Act's work more broadly, you can find our information here. We're happy to answer any questions that you might have. Thank you.